having breastfeeding troubles with my daughter, and then having the doctor just say, don't be so brokenhearted if it doesn't work out, but like not offering me solutions to my issues also left me a little jaded. And then I think that last encounter where my daughter was having a crying episode and I was brushed off was like the final straw, where I was pushed into the arms of the anti-vax movement.
I lost trust in my GI surgeon when he flat out told me that he didn't believe me when I said that I thought I had another condition going on. I went in knowing that I was going to get a bowel resection, and I asked to have a GYN present because I suspected endometriosis as well. And he said, "You don't have two things." Um, and that was just a very clear instance of him not even bothering to think about what I was saying or how that would impact me.
This past October, I had an appointment with my primary care physician where we agreed that I needed quite a few referrals. Over the next 4 or 5 months, I called the office to inquire about the status of those referrals. By February, when my follow-up appointment approached, I was livid. I went to this appointment loaded with anger and frustration that I had not gotten the referrals that I needed, and here I was already at the follow-up appointment.
Well, after the surgeries, the whole crew of doctors would come in every morning, 6 o'clock in the morning, and you would have like 9 doctors standing around your bed, and they're all asking questions and taking notes, but they're not telling me anything. And my family is obviously not there. My husband was there a lot of the times because he stayed every night with me in the hospital, just about. But they need to communicate differently, and I just had no clue what was going on.
The sources I used to validate my choices in not vaccinating came from an online forum, and it was a forum for attachment and natural parenting. Following that, I also started reading books by physicians, by pediatricians who also were spreading vaccine disinformation. And then later, of course, Facebook came, and Twitter and all of that, which started to really spread the disinformation around. I trusted those sources because the groups listened to my concerns, and there was a sense of community and caring that I didn't get from when I needed it most.
Yeah, I've had a couple of experiences losing trust. I was diagnosed at a fairly young age with Crohn's disease, and I think that first interaction is probably one that stands out to me the most. So when I was around 10 years old, I started experiencing symptoms. I was always tired. I was never very hungry. I was losing weight pretty rapidly. I was losing interest in activities. And I would get constant stomach aches and very often had throat infections that were never strep. And my parents brought me to the doctor, and time and again, I was told an excuse for those symptoms. So I was told that I was just an anxious kid, and that's why I was having stomach aches. I was told that the scale must have been broken, that I probably didn't lose that much weight. All kinds of different things that not only made me lose trust in my doctors and in the medical system as a whole, but really caused me to lose trust in my own body and in trusting myself and what I was feeling. Because it was at such a critical age, it was a hard thing. And so that went on for a number of years, despite symptoms like blood in my stool and things like that. finally, I was referred to an endocrinologist who did some blood work that showed that I was severely anemic. I was hospitalized. I had an emergency scope, which showed very clearly that I had Crohn's disease.
I work for a public health agency, and we often talk about disparities in healthcare and outcomes for BIPOC communities. This is usually associated with minority communities, but more often poor communities. And here I am experiencing such the same disparity, even with insurance and the ability to pay. And so I was frustrated with my primary care physician and my expectation of good health care.
I've denied a lot of treatments because of the payment plan and the money I have to pay out. I'm supposed to be followed by a dietitian because staying healthy with no colon and maybe 2/3 of your intestines is difficult. And I'm supposed to be followed by a gastroenterologist. My regular doctor just wanted to do a liver test because my liver enzymes are really high, and they have been since the surgery. But that test is $500, so I declined it. I declined a lot of medical because I can't afford it. I really feel that the hospitals should communicate more with their patients and with their loved ones, and not only about the health care that they're given, but the amount that it's going to cost. And a lot of people say that, money's no problem, but when it comes down to millions of dollars, it does count.
Healthcare providers can help the situation by listening. And I know that seems hard when we don't have a lot of time at appointments, or we want to just cut off the misinformation without hearing them out because it sounds so ridiculous sometimes, But listening is how you gain trust. So at that appointment, listen, if you don't know the answer at the top of your head, you can say you don't know. That actually helps build more trust. If you say, wow, that sounds scary. I don't know the answer, but let me look into that for you.
Communication is the largest forerunner to trust. I don't think doctors today have a lot of time or energy to communicate directly with patients. I will tell you that in my experience, my absolutely best doctor-patient relationship has been with doctors who personally took the time to call about test results and recommendations, and you just don't see that anymore.
I think even within a 15-minute appointment, there's a lot a clinician can do. Even as simple as making eye contact, a warm smile, letting them know that they're there and present and not distracted by other things. Those small things go a really long way in showing a patient that you care and you're there and present and wanting to hear them. Asking open-ended questions like, did we cover everything you wanted to today? Things like that. Even if there's not time, it's okay to say, let's make another appointment to talk about that. Being realistic and setting real expectations of what someone can expect next.
I suffer from PTSD with hospitals because of all I went through. So anytime I go to the hospital, I never had anxiety problems, and I do now.